Health insurance is for everyone in Edo State. So long you are a resident of Edo State, health insurance is for me. Health insurance is for you.
The National Health Insurance Scheme is a social health insurance program designed by the federal government of Nigeria to complement sources of finance in the health sector and to improve access to healthcare for the majority of Nigerians. However, unlike most developed countries, Nigerian citizens develop a state of apathy when health insurance scheme is discussed. Here are some of their reasons.
The truth is that you understand that what you don't know is bigger than you. A lot of people have not been sensitized about what it means to have health insurance. This is also as a result of the FACE system. It's also a contributing factor to people not having the awareness. Now, one thing is to have the awareness, another thing to have the access or the ability to do so. If we've been taught that from the beginning, the essence of being insured health-wise, then I think that will salvage that situation and also save us from that future impediments.
You know, health insurance is matter. Many people is sick, many is dying. You understand? There's no money to take care of themselves, even to fix the problem.
Others highlighted the reason for non-engagement in the health insurance program to lack of enough income as they cannot afford to engage in the scheme. Some added that due to low healthcare service delivery by the program, whereby they go to the hospitals and they do not get medications for free except if they pay in cash, or are told that the insurance scheme do not cover some medicines, are among the reasons for the lack of interest.
In Nigeria, we don't have that mentality of doing insurance, and again the way things are is not friendly right now. So somebody cannot be thinking of food to eat and not thinking of what to do for health insurance. I beg, it's not in our tradition. That one is for white men.
I think it's all about income, because when you look at the charges, most of these insurance firms and even the state-owned insurance projects are giving, most of them are ambiguous. You know, for instance, in my own office now, they deduct as much as 15,000 per month for insurance coverage. So most times, and when you even go to the hospital, most of them will tell you they recognize hospital by your firm. They will tell you that they don't do HNIS, NIS or whatever they call it. They will tell you they don't do it again. So all these contradictions, a lot of people cannot bear with it.
The insurance too, they are not reliable. That is one. And the package they are offering, when you get to the hospital, they will tell you your insurance does not cover this. So that is not encouraging people.
In an exclusive interview with the Acting Director, Public Relations Department of the Edo State Health Insurance Commission, Mrs. Trinitas Omonihu, said some of the reasons for the challenges in this sector, ascribing it to lack of awareness while emphasizing that the Edo government is committed to providing quality, affordable and accessible healthcare services to Edo people. She also said that cautionary measures are being put in place to make sure citizens who are engaged in insurance scheme get value for their money.
And sometimes this healthcare is actually not affordable. Sometimes the quality is not really up to standard, and sometimes it's even difficult to access this healthcare. So he brought the healthcare into existence on three main key areas: quality of service, affordability of service, and accessibility of service. So in 2019, he passed it into law through the State House of Assembly, so it is backed by law. As you can see, with regards to the different prices on this plan, there are several benefits attached to it. As you go higher, the benefits are more, the duration of these benefits increase depending on how high your plan is. So, and these health plans are not restricted to civil servants only, because there's this perception that health insurance is just for those who are working with the government, those who are in civil service. No.
In desiring a better and efficient delivery of public services, the provision of good quality healthcare should be considered a top priority to all citizens. Esoa Osemege reporting for BTV News.